Hello, my name is Kenny McKinnon, and I'm an assistant professor in the School of Social Work at York University, and I am principal investigator of the DARE study. I'll be characterizing discontinuation and detransition using latent class analysis. The DARE study is funded by SSHRC. So discontinuation and detransition do not yet have consistent or empirically driven definitions for understanding or studying these experiences, though they're often conceptualized as stopping, shifting, or reversing an initial gender transition. Pathways can include complex internal, external, and systemic factors. Objective 1 for the DARE study was to explore and characterize pathways to discontinuation and detransition, which is what I'm going to present today. In terms of study design and methodology, we administered a binational survey in the United States and Canada. To be eligible, participants were age 16 and older, living in Canada or the US, and have experience of ever stopping, shifting, or reversing a gender transition for any reason. And they could complete the survey in either English, French, or Spanish. Over 1,300 individuals took the survey, and following a strict eligibility and fraud check protocol, including Zoom screenings, we had a total sample of 959. We conducted a latent class analysis of the survey data in order to identify hidden subgroups. So individuals were probabilistically typed into a subgroup based on shared characteristics. We used indicator variables. The indicator variables were self-reported reasons for stopping or reversing an initial gender transition. And the reasons for stopping or reversing transition were grouped into discrete dimensions, including internal, external, or systemic factors, and participants could rank the level of severity using a Likert scale of these different reasons. So we used a four-class solution, and we have four different groups here. Group A being the largest group proportionally. Group A largely endorsed internal factors such as neurodiversity and mental health related reasons, shifting conceptualization of gender, as well as treatment dissatisfaction and complications with interventions. Group B is actually quite similar to Group A, with an internal shift in conceptualization of gender. However, they also strongly endorse treatment satisfaction as opposed to dissatisfaction. Group C is a complex, multidimensional group who endorsed both internal and external factors. As you can see, though, discrimination and lack of support is the most strongly and frequently endorsed factor. We also see treatment satisfaction and dissatisfaction appearing in this group. Group D is our second largest group proportionally, and they're the most dissimilar to Group A. So they strongly endorse discrimination and lack of support, as well as treatment satisfaction. To further characterize the groups, we looked at differences in assigned sex at birth. Groups A and B are where we see a larger proportion of assigned female at birth individuals appearing, so between 88 and 90%. Groups C and D is where we see more assigned male at birth or trans feminine individuals, with group D being 38% trans feminine or AMAB. We also looked at decision regret scores using this validated scale for healthcare decision making. So we asked, thinking about the decision you made to medically transition. So we see this, the highest scores on decisional regret in Group A, followed by C, and Group D reports the lowest levels of decisional regret. So discontinuation and detransition are heterogeneous and require individualized care. Stopping or reversing transition due to external or systemic factors may be better understood as discontinuation or an interrupted gender transition. These would be our classes C and D. Stopping or reversing transition due to internal shifts in identity and mental health or neurodiversity related factors may be better understood as detransition. These were our classes A and B. And satisfaction and or decisional regret may co-occur regardless of the pathway to discontinuation or detransition. Some references, and thank you very much. I look forward to discussing further in Lisbon.